one of the concepts that we teach is fewer well-planned visits. Okay, that starts from good diagnosis, which is good photographs, good communication, giving people choices, finding a way to make things affordable for them, and then having the good scheduling to do this. So this is an example of all of that. We took good photographs, did a good consultation, talked to the patient about what they wanted to accomplish, gave them a choice if we could do it all in one visit, would you like to? And she said yes. But I have a little bit of anxiety and fear, and then obviously we have to find a way to fit it into the budget. So we were able to handle all of that. Okay, so now we have her with sedation here. Okay, so we're doing IV sedation for her. You can see that she's nice and comfortable. And then what we're going to be doing today is we're going to be taking out tooth number 9. It's a post, and the tooth is fractured. She doesn't want to go without a tooth. There's not enough bone for immediate engagement, so then one's better. So we're going to prep 7, 8, and 10, do a printed bridge from 7 to 10, take out 9, socket graft for the future. Open up real wide. We're going to take out 15 here because of the large decay there. The remnants of 14. This is a good site for immediate placement for number 14. We're going to take out the remnant of number 19 and place an implant there. And then number 30 has a pretty big infection on it, so it's not a good candidate for immediate placement. So we're going to take out that and graft that area, and we're going to get all that done in today's visit. Before today's visit, I did a diagnostic wax up here, 7, 8, 9, 10. I have a putty stent in case we run into some technology issues on a printing side or time issues. So we have everything ready to go there. And then I'm just going to kind of review my prep design there, and we're ready to rock and roll. Here, so I'll get my final reduction done. Step. Stay open, Stephanie. Step. It's good. So what I've done here is I've used Teflon tape to protect our site, so that way my acrylic material doesn't get up in there. I had some issues with my design, so I'm not going to be able to print my temporaries. So I want to protect that to help prevent leakage and sensitivity. I'm going to put some bonding agent on here, a non-etching bonding agent. In this case, I'm using OptiBond Solo Plus. Quick cure on that. Open up, Mr.
It's just 89 as well.
Just relax. So I've been doing the shrink wrap technique for God knows 25 years now. It does a nice job. All right, so here we are. Our acrylic has set up. We're gonna pop that off, and there we go. Oh God, sorry. There we go. There's our temp cotton pliers, and so you'll see what I'll do here is now I'll just pull that out, and that's making sure I protected my graft material. And the temp itself is going to serve as like a membrane, in a sense, for our graft. That's good. So now we're using some diamond paste. You see that? $76. $76. Some more infected granulation tissue right there. There we can see the with that granulation there.